presenter, we have Mehak Malik from UV Health. So over to you, Mehak. Really look forward to your presentation.
Thanks, Tushar, for having me. And Hi, everyone. So I'm Mehak, and I'm building UV Health, which is a women's health platform focusing on sexual and reproductive wellness of women. So just to talk about the problem in brief, we have about 350 million women in India who are in the reproductive age group, and when it comes to seeking care, they undergo many challenges. One is lack of awareness about the symptoms and treatment options, which make them unsure. Second is the stigma associated with seeking care for such concerns, which basically requires that they want something that is discreet and confidential. With respect to certain disorders, there's also trust deficit because of certain patient philosophy and doctor philosophy differences around treatment, such as not wanting to use any hormonal medication or such methods of treatment. In terms of overall outcomes, we see that over 70% women are leading unhealthy lives. 150 million women suffer from some form of reproductive, sexual, or hormonal health disorder. And Indian women are menopausing 5 years earlier than their global counterparts. And about 27.5 million couples struggle from infertility. So, also, like more and more women are now getting access to the internet, which basically means that they are looking for answers online. They also have more disposable incomes, which is also, and COVID, in fact, has made it very palpable for them to seek virtual care. There's also like an unprecedented increase in Google search trends for different disorders, as mentioned here: PCOS, thyroid, menopause, sexual concerns, life stages like pregnancy, postnatal. And there is a breakthrough increase in local language searches because many of these women are in tier 2 and tier 3 cities, and they are looking for more contextualized content as well. So this is sort of a typical patient's journey and where it breaks down, right? Most patient would go to a GP or a specialist to get diagnosed. And once they get diagnosed, their treatment is very prescription led. They typically don't follow the doctor recommended follow-up cycle and would only go like to the doctor when there is a real emergency or need, and which basically means like long follow-up cycles and continuous prescription driven care in which the condition sort of deteriorates with time. And also on average, because of the doctor patient ratio we have in India and stuff like that, there is not enough time during the consultation itself to counsel the patient and tell them about everything they need to manage their condition holistically. So a typical patient would suffer from a typical patient would struggle with, what do I need to do to maintain a healthy lifestyle? Which symptoms should I be tracking? Which biomarkers should I be testing, and how frequently? They don't have any emotional support around their concern, and there's no single port of access that they can turn to. So this is where the UV model comes into play, where we are trying to build a continuum of care between those point to point visits that patients do. Right. Here we are building a platform where we give them access to coach led fitness and nutrition counseling, personalized symptom tracking through our app, access to top rated doctors and specialists, a care manager who can sort of triage or help or guide them towards the right set of expert, or help them in the form of giving an emotional support. We are also partnering with the labs to give them access to at-home lab testing services, and then a virtual support community, all of which sort of comes together to ensure that the patient is on top of their condition, throughout, instead of just only, when their symptoms get worse. And our entire model is digitally driven, which basically enables us to, personalize the user experience and enable them to track on the go. So we actually launched 4 months back. We went live with our app for PCOS and PCOD, which is our first areas of focus in terms of disorders. We're already like ranking number one on Play Store in India. We have over 20,000 installs, 13,000 platform users, and 1,100 plus subscribers. We're trying to bring like-minded like-minded brands as well as partners to kind of build a cohesive patient journey. So a little bit about our care model. So care plans is sort of the primary offering that we have on our platform today. We help a patient understand their root cause in a very simplified way that a patient can understand. That's not very technical, that's not very medical. Second, we take a whole body approach to care that sort of leads to more holistic treatment. And then finally, the way we design our programs is derived from clinical research and studies that have proven positive outcomes around the disorders we're looking at. This is an example of a patient assessment. This takes less than 5 minutes for the patient to complete, right? And in under 5 minutes, what would instead cost them at least 5,000 to 7,000 rupees in getting lab work and tests done, they can get a personalized report that gives them a percentage score of the 4 primary triggers or root causes of PCOS, and tells them what exactly they need to do to manage their symptoms. So these are the types of digital innovation we're trying to do in terms of building assessments and patient-centric tools to help them decode their condition better and build a pathway for what is needed to treat their concerns. We're also gamifying the PCOS management journey, and we want to extend that to other conditions too. So really, it's phases and levels based on a mix of tangible biomarkers and intangible success indicators that they can achieve, which would enable them to sort of climb across different phases and build a sense of long-term continuity in care, because a patient often feels lost after having tried something for a few weeks. They are expecting immediate results. So this gamification helps them see what the end outcome would be like and how much work is needed to get there. This is V1. We've done this on on WhatsApp groups and stuff, and now we have started to integrate that into our app. And we've seen very positive outcomes with the patients we've worked with so far. Fitness and nutrition are our primary offerings that we own in-house. We partner with doctors as consultants, would definitely love to have conversations with anyone here who would be interested in joining our mission. We've seen, on our flagship program, which is a 21-day bootcamp, we have seen an average weight loss of about 1.5 kgs among engaged users, and similar such changes across intangible symptoms too, which we feel, really help build patient confidence around the fact that the condition is manageable. I think this is really it. The way we engage with doctors is you could join us as a consultant. You could come and advise us on clinical protocols and SOP establishment. We are also looking to expand into thyroid, pregnancy, endometriosis care, etc. We would love to interact with experts here and get their advice in building these programs from scratch and building interactive assessments for patients. And we also organize webinars both for our patients as well as with corporate partners to engage with women. Anybody who feels interested in that, we would love to interact. So that's really everything about UV. Thank you.
I think, Mehak, excellent presentation by you, and this is something which is the need of the hour. We all know the women's health is very much neglected in our country, and whenever it comes to health issues, the male is always given a preference over the females, and this is happening at almost all the levels. Even if they get the priority, they are not able to take care of themselves because they are engaged in other taking care of all the other family members. So I think your concept is very, very unique, and it brings a lot of attraction, I think. And we have many projects on which we are working on women's health. So we will definitely love to connect with you and your company, and to how do we associate and take it forward, and how we can actually work together to improve the lives of people, females or women living with a lot of metabolic disorders and the conditions. Excellent presentation. Thank you.
Thank you. Thank you.